first group of patients has been admitted to the hospital that was built at breakneck speed in Wuhan City, the epicenter of the coronavirus outbreak. The Huoshenshan Hospital was built in just 10 days. The 1,000-bed hospital is one of the 2 dedicated facilities constructed to cope with the virus outbreak.
Well, local reports said that 1,400 Chinese army medical staff specializing in infectious diseases have arrived in Wuhan. They're being transferred to the new hospital. China is struggling to deal with the virus, which has infected more than 17,000 people and killed more than 360.
Meanwhile, China has called for stricter measures to deal with the rapidly spreading outbreak. This comes as the extended Chinese New Year holiday ends and people return to work.
Well, Wenzhou, that's in eastern Zhejiang province, has seen the most coronavirus cases outside of Hubei province, with a total of 265. Now, some 180,000 people from this city of 9 million study or they do business in Wuhan. And on Sunday, authorities, they took action in Wenzhou, closing roads and confining people to their homes.
Premier Li Ke Qiang urged businesses to adopt a flexible work schedule to avoid large-scale population movements. Many regional governments have further extended the Chinese New Year break by another week. Hubei province said offices and schools will remain shut until February 13th.
And for some analysis, we're speaking now to Dr. Amish Adalja. He's senior scholar at the Johns Hopkins University Center for Health Security. Dr. Amish, the death toll in China, it has jumped. It's now surpassed the SARS death toll. What's making this virus so fatal?
What we think is happening is that the fatalities have to do with underlying conditions and older age. We're not seeing as many deaths in younger individuals as we are in older individuals, and there's a lot of risk factors that need to be delineated, but what we're really seeing is that this really poses a risk to those that are elderly and with underlying conditions.
Well, China has been racing to build entire hospitals within days. How would this impact the virus spreading elsewhere?
The fact that they're able to have places for people to be treated safely and to remove some of the surge that's happening at other hospitals that are inundated with patients will make it easier to control the virus and actually get people better care and decrease some of the panic. So these hospitals and this increasing bed space that they're having there is a good thing.
Dr. Amish, let's get your take on what's happened with these travel bans that we've seen from certain countries with regards people from China sort of going to other countries. We've got the United States, we've got Singapore as well, putting these travel bans in place. China's not happy about it. They say it runs contrary to WHO's recommendations. Do these bans help contain the spread of virus sort of adequately?
Based on what we know about this virus and how easily it's spreading in the community, the fact that there may be asymptomatic spread, people spreading without symptoms, and that we have this in almost 24 countries, and it probably was spreading for a couple of weeks before any indication of that the Chinese had any indication a new virus was at hand, really argues against these travel bans. I do not think they will be effective at stopping this virus. I think that really we have to move from thinking about containing the virus to actually dealing with an outbreak that we're going to have probably in many different countries and getting our healthcare system ready to handle those patients.
Well, speaking of readiness, perhaps, reports out of Thailand are saying a cure for the virus has been found. What have you heard about that?
Well, we have known for some time that there are certain antiviral medications, including ones that are used to treat HIV, that may have some effect on coronaviruses, and we're seeing people do clinical trials with these drugs. What you heard from Thailand is a combination using an HIV drug and an anti-influenza drug or a flu drug. I think it'll be important to study that combination properly. We're hearing anecdotal reports, but you really need a clinical trial in order to determine whether or not these are really truly effective. So what we need to do is start running clinical trials on certain drug regimens to see how effective they may actually be.
Apart from Thailand, of course, Gilead Sciences has also attempted to use a drug, and they've reported some success with it as well with patients there. But as you say, medical research, more has to be done in order to determine just how effective they are. But of concern as well, and also getting much traction, this talk of perhaps a vaccine. There are teams working on that. Do we have any idea of success or progress that's being made on that front?
It's a very early stage of vaccine development against this novel virus. We have multiple different companies trying multiple different approaches. We may see some early clinical trials in several months. However, I don't expect that we're going to have a vaccine for this within a year, with at least a year, because vaccine development is something that's measured in years, not months. This isn't something that's going to be easy to create and scale up and have commercially ready to go throughout the world for some time, because vaccine development is tough and manufacturing is tough, and there's a lot of open questions about how this vaccine will work before we can actually use it.
Well, combating a virus such as this, it takes its toll on those on the front line. In Hong Kong, medical workers have threatened to walk out tomorrow if the China-Hong Kong border is not sealed. And what sort of impact would that sort of strong action take?
Sealing borders and using draconian methods to control populations during outbreaks always backfires. It ends up creating more resentment from the population, less trust of public health authorities. It causes people to want to hide their illness. It makes it much harder to battle the virus because it makes it logistically much harder to get into those areas where the virus is spreading. So these kind of control measures are not what you do during an outbreak. You want to do the least restrictive methods that you can.
Dr. Amish, there's also a lot of focus on what we may see in terms of the peak of this viral outbreak. Many people sort of speculating on that one, some saying it might come at the end of winter when the flu season or many viral sort of infections tend to sort of taper off as summer comes about in China. Do you have any take on that, on that speculation of just when this outbreak will peak?
We know that coronaviruses have a seasonality, that they rise in the winter and spring and then go away during the summer. I think we will probably see a similar type of pattern with this virus, but it's too early to completely say it will follow that pattern. But I think there's a lot of good data that shows that coronaviruses have seasonality, and maybe we will start to see cases ebb when spring begins and when summer is about to start.
Well, the sooner the better, I'm sure, for health authorities in countries all over the world. Dr. Amish, thank you very much for your perspective on that. We've been speaking to Dr. Amish Adalja, Senior Scholar at the Johns Hopkins University Centre for Health Security.